We know that there are 3 or 4 types of liver disease that is prevalent in the world today, and these are alcohol-related liver disease in the West, but these are also common in many parts of India. Apart from alcohol, we know the other diseases like hepatitis B and hepatitis C related liver disease, which leads to cirrhosis and cancer. So these are also very important issues. And now these 3 diseases are being actually exceeded by what we know as fatty liver. Fatty liver is non-alcoholic fatty liver disease, which was thought to be prevalent in about 20% of the population in Western affluent countries. But in India also we have data to show that our population also do suffer from non-alcoholic fatty liver disease, and there are differences between the West and the East. West Bengal government, as we are aware, is trying to increase the affordability of the people who are actually attending the government hospitals, and it has been a policy to offer medicines free of cost. That is one, and also to offer the inpatient treatment for major surgeries that can be done at a very low cost, and they are also trying to build up the specialities and super specialities in the districts. Like also the district hospitals will have cardiologists, gastroenterologists, and this is the part of the infrastructure. And lastly, they are also now trying to implement policies so that organ transplantation may be done easily, especially the legislation for cadaver transplant is being encouraged. So now this is also a reality that if somebody offers an organ, then there are facilities are created so that these organs may be used for transplantation, especially cadaver transplantation. We know that the need of the hour is to make health care and health services affordable, because both in other disciplines like cardiology, the liver care that we are concerned with is also becoming quite expensive, including treatment for many viral diseases like hepatitis B, hepatitis C, and sometimes with liver failure they need to be hospitalized for a long time, and which is quite expensive, and ultimately they may need transplantation. So to actually address this issue, we have to actually look into the affordability quotient, and we know that there are 2 sections like in government hospitals, and also there are high-end corporate hospitals where the treatment facilities are available but at a high premium. So we have been thinking in terms of having a third sector, which we call third sector, which may be placed in between the government hospitals and the private hospitals or corporate hospitals, where treatment can be offered at a lower cost and can make these other options like transplantation affordable, for which we need to have a NGO-like approach, where we need some government support, but ultimately the expenditure should be much less than in corporate hospitals. Peerless Hospitics Hospital is about 25 years old into private health care. They are tertiary care hospitals, though the transplantation program is not yet off the mark yet, but they offer all other kind of therapies like CABGs, heart surgeries, angiographies. There are renal dialysis units. There are full-fledged gastroenterology services along with surgical services for laparoscopic surgeries and cancer surgeries. But we are now intending to start a liver transplant service, which is not yet has been launched yet. I have been actually thinking about the other possibilities that I was mentioning, that we are involved in a body called Liver Foundation West Bengal, where actually this is a NGO which is involved and dedicated for both for prevention and management of liver disease and gastrointestinal liver disease in particular, and all kinds of GI diseases. We have been fortunate in receiving grants from many sectors, including pharmaceutical industries. So we are involved in imparting the basic knowledge and awareness about conditions, like most of them has to be thought about socially. Societal problems like alcoholism, like hepatitis B, like hepatitis C. Hepatitis B in particular we are trying to address because it has a very efficient vaccination program, and government is also now has made this vaccination available through its healthcare system. So once we advocate people, we go to the villages, to the district towns and subdivisional towns, and we are actually imparting this basic awareness about the disease and how to prevent it. And if we can prevent this disease, then we can really prevent the outcomes like cirrhosis and cancer, which is a very costly proposition. And it has been shown that in our country, they affect the middle-aged people. When they are in the prime of their career, in the 40s and 50s, these patients do suffer from cirrhosis and cancer. So prevention of these, serious liver diseases is very important issue, and for which one must work from a very basic situation. And the role of vaccination awareness is very important. At the same time, we are also against alcoholism, which is not too uncommon even in Eastern India and in Bengal. Like in the other parts of the country, like in South India or in Punjab, we know the alcoholism is probably the most common cause of liver disease. So we have to treat it and we have to fight it out socially, and for which we need the support of the other media, so that we can fight the scourge of alcoholism. About the future perspective, we are thinking in terms of making healthcare services affordable, and we have recently launched this Liver Foundation Hospital, which actually is going to be run on a cross-subsidy model, where actually the same services maybe which will be based on two things. Number one, we want to have donations from corporate social responsibility from many organizations, including our pharmaceutical industry, then there may be industry in general, and also from organizations, government sector, like State Bank, like other Indian Oil corporations, ONGC. So if we can have donations from the corporate social responsibility allocations, then one can start having a high-tech hospital, and then you can run it on a cross-subsidy model where the cost of therapy may be distributed among the income-based patients. Means the cross-subsidy will be really the model where you can actually fund generation is from the affordable sector of the population, and you can also at the same time this can make the health services affordable for the other poorer section of the society. So I think this model, if it clicks, it can be a path breaker in relatively rural, agrarian and relatively middle class patient population.